So if you've got somebody who's like, yeah, I'm an esthetician and I can put Botox in people's forehead or whatever, that's not much different than me injecting stem cells into somebody's knee joint. Yeah, it is, right? And
Yeah.
if that doesn't work and if that patient gets infected, like are you capable of handling that? And the answer is you're not, right? It's an insurance company to pay for your Apple Watch, right? Like you're paying that out of pocket. So go in and see a doctor and pay for a DEXA scan or pay for, get your hormones evaluated. Like do preventative stuff and just suck up the fact that there's no third party that's going to pay for this.
Yeah.
And it's going to end up being better care for you, you know.
Maybe that's a way we could change. Maybe it should be part of your baseline health care situation. I mean, the insurance company's making so much money. Why should they not be paying for you to have preventative measures that are above and beyond what we currently have? Where you have a wearable or you have a glucometer, you're wearing a glucose because those people that can measure their glucose throughout the day can manage their diabetes better, which then, long term, better for their health. Maybe the insurance company should do that. I got a crazy idea. Why don't the insurance company donate 50% of their profits every year to medical schools to pay for surgeons to be trained to become doctors? How about that?
Yeah, yeah.
That'll be the day, right?
Good luck with that.
Yeah, I know. I'm saying wild idea, but think about that. Like we're losing doctors. People are not going into medicine. Like you guys are overworked because more and more people are saying, "I'm not doing this." We're going to get to a point where we have no doctors that can actually take care of people. Then what are we going to do? Yeah.
Rely on some robots, I guess.
Yeah, I guess Elon Musk is going to build
Whatever
some robots
ChatGPT
with
says.
Neuralink, and he said that we're going to replace all the doctors in the next 5 years, right? So
I saw that.
Yeah,
It's
but
just a
there's,
tool, man.
I'll tell you what, though, like you better embrace some preventative medicine and start taking care of your own health because right now the med students are using Chat GPT to get through med school,
yep,
right? So
you are
those are your
100%
future
correct.
doctors, right?
Absolutely. Yep.
Yeah.
You know,
Rely on the algorithm to get the answers.
that's right.
But yeah, the wellness clinics are that have, become really popular. Like I think it went from like med spa to now like wellness clinics where people are going to get these tests. Now, the people who open up these wellness clinics are looking to take advantage the American capitalistic way, where there's opportunity here to charge big dollars, and they're trying to sell you on something when you walk in. However, it is really nice to see an alternative approach to looking at health care, self-health care, and but I think if the traditional mainstream health care world applies itself into that space, it can set some guardrails, safety guardrails around that. Because I think a lot of decisions are being made by those who don't necessarily have all the knowledge. Now, in a lot of spaces, you need at least one physician in that practice to be able to have that clinic, et cetera, et cetera, et cetera. We're going down this rabbit hole. But to embrace the idea, because one helps the other, right? One of them can prevent the patient from having to walk in at the point where their BMI is out of control, and now you're wondering, should I operate on this person? Well, if we would have educated them on nutrition and gotten them on whatever sort of injection that can help their, I don't know, I'm out of my league and my space with this, but kind of makes sense. Sounds like it makes sense.
Yeah, you're not wrong. Like the who that does this is super important, right?
Yeah.
Like the stakeholders in the preventative wellness movement is very important. Like we've seen that in orthopedic surgery in the orthobiologic space. Like I don't know how much you guys know about this, but it's the sort of the stem cell world and some of these regenerative medicine type options for musculoskeletal problems. What ended up happening is that there really wasn't enough solid data for orthopedic surgeons and other sports medicine providers to go forward with the orthobiologic stuff. But other people didn't care, and it was a self-pay item, and they went to market with that stuff anyway, right? So you ended up with like estheticians and chiropractors and other people sort of injecting people's knees um, with, whatever stem cells or
Yeah.
whatever, without without the training or the understanding of the biology or the ability to handle any sort of complication or plan B if it goes wrong, and that's your point, right? Like there are a bunch of people that are out there that want to be capitalists and want to sort of profit from this type of stuff that aren't really trained and shouldn't be providing healthcare services, right? Or at least shouldn't be injecting people, So if you've got somebody who's like, yeah, I'm an esthetician and I can put Botox in people's forehead or whatever, that's not much different than me injecting stem cells into somebody's knee joint. Yeah, it is, right? And
Yeah.
if that doesn't work and if that patient gets infected, like are you capable of handling that? And the answer is you're not, right? So um I think that there is a way for trained physicians who are burnt out, who are sick of being in the system, to kind of pivot to some wellness and preventative stuff where it's just now coming around that we do have the tools and the technology to be pretty effective with that. Like, think about it with just the wearable things that we were talking about, right? To monitor, yeah, like a ring or a watch or whatever that monitors your blood glucose all the time, or counts your steps, or checks your heart rate, or whatever. And then add on top of that things like the GLP-1 inhibitors, right? Like, you have pharmacologic options now that we didn't used to have, that can prevent the complications of obesity and diabetes. You have testing now where we have sophisticated functional MRI testing that you can do. We have, like, I'm working with Georgia Tech right now with it on a knee brace that you can put on your knee, and it attaches to your watch, and it will tell you if your gait is altered and your knee is seeing a poor load pattern,
Mm.
which is great for people who like to walk and run and hike. And it gives you real time information on what's going on in the knee as far as knee effusions and inflammation and synovitis and things that are happening. And it can also tell you that the way that your gait's being altered as you unconsciously compensate for it, right? So there's all of these tools now that if you could package all that together, you could be like, look, you're going to pay me for this out of pocket, but here's your plan, right? Here's your nutrition plan. Here's your weight loss plan. Here's your strength training plan. Here's your cancer screening plan. Here's bioidentical hormones. Here's, we're going to start you on Ozempic for a month and see what happens to your body mass. Here's, your colonoscopy screening. We're going to set all that stuff up. And have somebody that puts a comprehensive plan in place before you get sick. Um, and that's how we're going to prolong life expectancy, right? Like, this is not a third world country, right? Like, we should be providing better healthcare than they're providing in the Sudan,
Yeah.
and we have the ability to do it. We just don't have the system to do it.